Hi everyone, welcome back to my channel. So I'm looking down here, I am looking at my Twitter account, and I saw a tweet the other day. It was in response to a tweet about pregnancy. And this guy said, depending on which study you check, you can find several. Several meaning that there are advantages, health benefits of pregnancy. And this is, I'm assuming this is from a man. He said you can find several advantages or benefits: lower risk of MS, lower risk of certain cancers, improved cardiac health. Some studies literally just prove that overall you're more healthy afterwards, almost like every single trait we have is designed for reproduction. I have never in my life seen a wronger tweet ever. That's the only way that I can express that. This is such an incredibly wrong take. That's why I can only assume it's from a guy, because I don't. I feel like it's common knowledge that pregnancy and postpartum is very risky for a woman's health. I was in absolute disbelief that this guy said this, and he kept doubling down because I responded to him, and he kept doubling down on it. So I wanted to address each thing that he said. So he said that it lowers your risk of MS, it lowers or basically lowers your risk of autoimmune, certain cancers, and helps your heart, right? Improves cardiac function. All of this is wrong, and pregnancy actually puts you at higher risk for all three of those things. So let's go down the list here. So like I said, I thought it was common knowledge. I believe most women know that pregnancy is a high risk health condition, and it can be lethal. It can even put your life at risk. A lot of women, when it comes to autoimmune illness, a lot of women note that their condition started. So a lot of times women have these conditions even beforehand, but for whatever reason, pregnancy becomes a trigger and the condition basically takes off after that. So they feel like pregnancy or postpartum triggers this condition that they may have had, or maybe it was just underlying. So Selma Blair is one of those people. She had been kind of symptomatic here and there through her, adolescence, adulthood, and then once she had her son, she said that was when she really just started becoming very ill, to the point where she was disabled. I know two people in my own personal, well, I don't know them, but they're friends, old friends of mine. And one of them developed a rare, I don't know if it's an autoimmune condition or if it's just some kind of condition. It's a genetic, it has a lot to do with genetics. And it was, I think, probably a year after the birth of her second son. And she ended up being hospitalized. It could have been life threatening. And they had a really difficult time identifying what it was because it's a rare condition. But she was finally diagnosed. She had to eliminate certain things from her diet because those were triggers for the condition. And she's doing well now, but it's going to be a lifelong condition. And again, she didn't know she's genetically predisposed, but it wasn't until after the birth of her second child that it really got going. And then I have another friend who had cancer, and she was only in her probably mid 30s. And this wasn't right after her pregnancy, but she had twin boys, I would say probably 7 or 8 years before. But again, to have cancer that young is really, I don't know, it just seemed very unusual to me. So what is the theory behind this? They say the one theory is that there's a lot of complex hormonal and immune related shifts during pregnancy. So I guess that sort of shifting and back and forth can cause your immune system to start attacking itself, or just to kind of go haywire. Another theory is that fetal cells that are in circulation during your pregnancy may be the underlying cause. microchimeric fetal cells, and the onset of autoimmune disease after pregnancy. So those two have been linked. So that's another theory there. Um, so here's a crazy thing, and for those people, sorry for the pro-life crowd. So they did the study. So there was an association with an increased risk of developing autoimmune illness after a C-section. So basically you had your full-term pregnancy, but you instead had a C-section instead of vaginal birth. It's just like having a regular birth, right? You carried the child to term, had the child, so your risk was basically increased to have to develop an autoimmune illness. But if you had an abortion, you have a decreased risk of developing autoimmune illness. So, I think that's because those hormones and those fetal cells there's not as many, and they don't develop all the way. The fetal cells don't develop all the way, so they don't have that increased risk. They don't get to full term, I guess. And the one thing that I was reading was that the decreased risk after abortion is because you do get those stem cells, those fetal stem cells. So that actually helps you, and they don't get to the later term cells, which are actually the ones that may hurt you. So that's kind of in a nutshell. I'm explaining it in very common terms because that's the way I understood it. I don't know the exact scientific reasoning, but that was sort of the description or the basic description that I understood. And as we know, stem cells can reduce inflammation and help with certain types of conditions, so that would make sense. It's just when they're fully developed fetal cells that they become, I think, a little bit more harmful to a woman's body. So, as we know, autoimmune disease is more common in women overall. So like I said, in the first year after conventional pregnancy or cesarean section, women had a 15 to 30% increased risk of autoimmune disease, but a 30% lower risk the first year after an abortion. And that's because of the fetal cells, that they stay more stem cells instead of the other more potent cells when the fetus continues to develop. And those are the ones that I guess are a lot more taxing on a woman's body. So yes, pregnancy can both reduce and increase, this is the next point. Pregnancy can both reduce and increase the lifetime risk of cancer. So that I think is a little bit more complex. For autoimmune disease, I know for a fact, and I knew this even before this guy tweeted this, that it does increase your risk of autoimmune illness. And a lot of women feel that the onset or the worst symptoms of their autoimmune illness took off after, a pregnancy. When it comes to cancer, it was a little bit more convoluted, but I really felt, I was like, I know I've seen information out there that says that cancer risk is also increased after having kids. And it would make sense because, again, of those hormonal shifts. But I decided to just keep, looking into it. So hormonal changes can stimulate certain specific cancers like melanoma. So that's one. But that is more rare. So I guess the link there is not as concrete. It's a little bit more rare to find, cancer onset after pregnancy. Some factors may increase the risk of breast cancer. That makes more sense because of the types of hormones that are involved. But here's the specific criteria. So your cancer risk after pregnancy increases if you are older age at the birth of your first child, so 30 plus years old, which isn't really that old, but you know how it is. So if you are older age at the birth of your first child, If you've had a recent childbirth. So that's kind of like weird. It's like, well, a recent childbirth, if you're giving birth, that's a recent childbirth. So if you have just had a child, then your increase, I guess, goes up dramatically right after that birth. And it takes 10 years to decline. So if you have a child at 30, your risk doesn't decline until 40. So I'm kind of like, why are they saying that there is no increased risk after having children when there is an increased risk that can last for up to a decade, whatever. So, and the third criteria is the use of DES, which is a synthetic estrogen during your pregnancy. And I was like, what is that? Why would women need to use that? So DES is a synthetic estrogen that is used to prevent miscarriage, prevent pre-labor complications. But it was discontinued in 1971. So I have no idea. So I don't really know if that is still used, but I guess it's used to keep you from having a miscarriage or a risky pregnancy. So, but that at the same time will increase your cancer risk later in life. Daughters of women that used DES also have an increased risk of cancer after age 40. So it's not just the woman that used it, it's their daughters as well. So not only was this guy wrong with his tweet, he's like incredibly wrong, because the risk is not just increased for the woman, it is also increased for her daughters that didn't even use that. But again, like I said, there's those 3 specific criteria that will increase your risk of cancers postpartum. So let's talk about the heart. So, like I said, changes in your body during pregnancy include hormonal shifts. We talked about that. That increases your risk of autoimmune illness and cancer. But it also increases your blood volume, obviously, which can increase your heart attack risk for up to 12 weeks after delivery. So tell me how pregnancy is protecting your heart. 12 weeks. You already had the baby. And I'm not even talking about the risks while you're pregnant. I had to catch my breath with this one. I'm talking about after postpartum. We're talking postpartum here. So it can increase your heart attack risk for up to 12 weeks after delivery because it makes your heart work harder. You have more volume of blood. Your heart has to take your same heart that was dealing with your body without pregnancy, without another human in there, without all this extra blood, now is having to do all of that situation and is making your heart work a lot. Your same heart work harder. There's something called peripartum cardiomyopathy. It begins about 1 month prior to delivery, and it is more common in women that have high blood pressure, diabetes, obesity, that have used substances. So again, there are risk factors, and I think this is the reason why. And you guys are going to see this in some of my videos when I talk about fat phobia and weight. Whether it's being overweight or being underweight. A lot of these conditions can be connected to weight, and I think that's why being heavier is a risk factor for everything. Diabetes and obesity are obviously connected to obesity. And so that is going to put you at a greater risk of having these heart complications during your pregnancy. So yes, there are caveats here. There are this criteria that must be met, but to say that pregnancy is actually protective of your body is absolutely not true whatsoever. It really takes a toll on a woman's body, even women who are in perfect health. Women that are in good health are still at risk of thyroiditis, pelvic pain and incontinence, blood clots and hemorrhaging. a lot of times you can't really tell what's going to happen until you're pregnant, and sometimes until you are late in your pregnancy or postpartum. And of course, postpartum depression, which can become a chronic condition, is a huge, we're barely starting to learn about postpartum depression in the last probably less than a decade. I don't remember hearing about postpartum depression even when I was in college. And that was, I graduated in 2006. So, there are so many things. Obviously, if you're not in great health, like those of us that are chronically ill, your risks are going to be much higher. But even for women that are perfectly healthy, incontinence. I remember one of my physical therapists, my pelvic floor physical therapist, and this is a physical therapist, someone who is, she's taking care of her health. She knows the risks, particularly the risks with pregnancy. She said she wanted to have 4 children. I think she had already had 2 when I was seeing her, and she was pregnant with her 3rd. And she said, I want to have 4, but I know that if I have 4, I'm more than likely going to be fecal incontinent. So there's urinary incontinence, which most women develop after, I think, even like one pregnancy. Like when you sneeze and a little bit of pee comes out, that's also part of incontinence. That's like a mild incontinence. Being fecal incontinent means that you're passing feces when you're not going to the bathroom. So that's a huge risk the more children you have. But even just one child can leave you with that little bit of leakage and stuff like that. And those are chronic things. Those are not things that, you have to go to physical therapy or get sewn up, after after you give birth, and go to physical therapy and do all of that. That takes time. So these are not issues that are going to go away overnight or that are going to disappear by themselves. So, pregnancy is very dangerous, and I'm glad that we're bringing more awareness to this. And I want to be very clear that it's dangerous. It can be life-threatening. Like I said, our new awareness of postpartum depression and all sorts of other postpartum things, and women don't talk about this. Number 1, because it's embarrassing. Number 2, because we have to continue to pretend that having children is this great, miraculous situation. And if we say something bad about it, we're bad. And I really, really hate that. But that's another video for another day. I actually have done a few videos on being chronically ill and having children, whether disabled people should have children or not. And it is a controversial topic. And I actually see that the chronic illness community is very split with that. But go and watch that video. If it's already up, go and check that one out. But this is without question, pregnancy is very, very dangerous. It has been a known trigger, particularly for autoimmune illness. And I have no idea what this guy is thinking. I mean, there is nothing, yes, there was a little bit of information that said it could extend your life. I think part of the reason why it extends your life is because you have children. You have, causation. What is that thing? Causation doesn't mean correlation or something. Some people may just fight more to stay alive because they have children. For example, if you get cancer, you're going to do more to stay alive. You're going to do every treatment, everything possible. You're going to take better care of yourself if you have children than if you don't. So that doesn't necessarily mean that pregnancy is what is extending your life. It could simply be the fact that you have children and you're saying, you know what, I need to take care of myself a little bit better because I need to be around to feed these children and to see them into adulthood. So to say that pregnancy is protective, I need to see some concrete evidence, because the only concrete evidence that we're seeing right now is that pregnancy does increase your risk of a lot of conditions. Autoimmune illnesses are one, but there's a bunch of other stuff. I mean, I thought that was just common knowledge. But anyways, I had to get on here and make this video because it was just something that I was like super passionate about. And when I saw his tweet, I was like, you could not be more wrong. So thank you so much for joining me. If you have any more information about this topic, please leave it in the comments, because, you know, I'm sure that there is just, a plethora of information about pregnancy and, the risks to your health out there. But yeah, let me know. Like and subscribe.